Hi, my name is Christina Collins. Before meeting with my client, I have made a list of things to be aware of, such as cultural consideration when making assessments, diagnosing, and treating a minority client. My client is an Hispanic male with the presenting problem of loss of job, which has led to depression and alcohol abuse. There are 4 things that I will be taking into account for my session with Mr. Quesada. The first consideration would be some cultural considerations, which could include the following. Identify the phase in which my client is in according to the racially, culturally identity development model. What beliefs are held about the mental health process? What are some of the stigmas associated with seeking mental health professionals and being diagnosed with a mental illness? And how often does Hispanic male seek treatment? Also, I would like to learn more about the family dynamics, the values, and the client's worldview, which would be necessary to aid me in making an appropriate diagnosis of the problem and treatment plan. A second consideration is to compare and contrast taking an etic approach versus an emic approach. An emic approach, a client at the conformity stage would be treated, assessed, and diagnosed like the dominant culture. So I would focus more on the depression and the alcohol abuse and minimize or exclude talking about the loss of job. I would diagnose the problem as being an internal problem. Whereas if I chose to use an emic approach, a client at the resistance and immersion phase, I would focus more on the loss of job, and I would also diagnose the problem as an external problem. A third consideration to be taken into account would be my ability as a therapist to establish trustworthiness, credibility, and expertness. I would like for you to focus on, in this next clip, my introductions, my ability to use proxemics in giving the clients control over whether I sit far away or closer. Also, I would like for you to pay attention to the setup of the office. I used a small coffee table and a lamp instead of overhead light, so that it wouldn't feel like an investigation, and I wanted it to feel warm and make it more conducive so that he would talk to me and confide in me, and he would trust me and believe that I was here to help him. And the fourth consideration that I would like to talk about is the didactic combinations, which include over-identifying with the client, encountering clashes in the cultural values, and dealing with the stage in which the client is in according to the racially, culturally identity development model. You will see and hear more about the didactic combinations in the following clip and the narration. Let's take a look.
Hola, me llamo Christina Collins. ¿Cómo se llama?
Joseph Quesada.
Mucho gusto.
Igualmente, gracias.
Okay, so I see you have the informed consent sheet.
Yes.
Okay, and could you arrange the sitting position that'll make you feel most comfortable?
Sure. Like this one.
Okay. Okay, so how are you doing today?
I'm doing well, thank you. How are you doing?
Okay, I'm great. Okay, I would like to begin by explaining the counseling process and the informed consent sheet that I had you sign. The counseling process is a collaborative process, meaning that it will take both the therapist and the client working together. I will need you as a client to help with your energy and your knowledge to aid in treatment goals and assignments. I also expect you to comply with any homework that I may assign unless something unforeseeable happens that prevent you from completing this assignment. Also, I would like to elaborate on the confidentiality issue that was expressed and explained in the informed consent sheet. I want you to know that anything and everything that you say here will be protected by confidentiality, and that by no means am I obligated to share this information without your permission. However, there are certain circumstances in which I will have to breach confidentiality, which includes the following circumstances, such as child abuse or neglect, elder abuse or neglect, a court subpoena, or if you as a client is perceived to be a threat to yourself or to others. And I also would like for you to know that this is a safe place and that you will not be judged or criticized, and that anything and everything that you feel is allowed. You are allowed to be upset, angry, mad, depressed. However, I will need you and I will encourage you to discuss some issues that may be a little difficult and that may bring up some feelings in which you may not want to feel at that moment. But I will encourage you to go on, but I will not force you. I also would like for you to know that if you do not see this as beneficial, that you have the rights to stop this process. You can also refer out and you can ask for another therapist that may fit your particular needs. Do you have any questions?
No.
Okay, do you have any questions about the payment fees or risks associated with coming today?
I don't.
Okay, so let's begin by talking about your family structure.
Okay, sure. Well, my family is myself, the husband. I have a wife, and I have 2 kids, both males. Up to now, everything has been fine, but I just lost my job. It's led to some depression. I've started drinking quite a bit just to kind of get the depression out. And instead of curing the depression, it makes me feel more depressed, so I'm having more issues. And then the reality of not being able to find employment as fast as I thought I could is setting in. Bills are piling up. It's been pretty bad.
Okay. And so how does that make you feel not being able to provide for your family?
As a man, it makes me feel worthless, really. I feel that there's no place for me. My role is to be the provider, and right now I'm not doing it.
Okay, so would you say that the unemployment led to the heavy drinking and the depression?
I would say so.
So what goals do you have for treatment?
Right now, my goal is just to get better, get on my feet, get employed, start providing again.
So would you like to talk about your depression first, or not having a job? Where would you like to start?
Probably unemployment, since I think that's the reason why my depression is where it's at.
Okay. So what have you been doing to try and find jobs?
Right now, I've been applying everywhere, and I haven't had any luck. I was particularly good with one set of skills, but I see that in that department right now, there's not too many jobs. So that's caused me to start applying everywhere else to see if I can just start landing a job and get on my feet, and then maybe later I'll find something better.
Okay, so the goal for this therapy session will be to locate some job sites that are looking to hire people with your particular set of skills.
Okay.
Okay, and so the next time we come in, I will forward you some temp agencies that are hiring, and I would like for you to go talk with them, and you can tell me how that goes in the next session.
Okay, sure.
Okay?
Thank you.
Hello. Talking about the client's family, values, and worldview, I was able to assess the degree of acculturation and the stage my client was in according to the racially culturally identity development model, which was the resistance and immersion phase. With this information, I decided to take a more active and emic approach in dealing with the presenting problem. Instead of taking a passive approach, I became an advocate for my client by giving him a list of prospective jobs that were looking to hire. Because I decided to take the emic approach, I diagnosed the problem as an external one. Because of the client's experience with discrimination, because of my beliefs that the problem was external, I expected that the loss of job represented a loss of status in the home where he was the breadwinner. The inability to provide for his family led to an increase in depression and alcohol abuse. So, finding a job would lead to a regain in status within the family and a decrease in depressive symptoms and abuse of alcohol. Things that I was aware of and knowledgeable of include the following: my status according to the racially culturally identity development model, which is at the introspective stage, and my client status, which is at the resistance immersion phase. I was also aware of the rarity of Hispanic males and the Hispanic American population's lack of trust for mental health professionals. I was aware of the stigma that was associated with seeking mental health professionals and being diagnosed with a mental illness. I was also aware of and knowledgeable of the cultural difference between the client and myself. So an example of encountering cultural clashes was that my client believed that women should not or could not work outside the home, that it was not their place to. However, this is contradictory to what I believe. However, being at the introspective stage, I was able to respect my client's belief and not impose my beliefs onto my client. Also, I was able to prevent myself from over-identifying with the client because of our shared experience of discrimination. I also was able to contact the client's wife and job sites he applied to ensure my client was actually looking for a job. The skills that I used in the session were some nonverbal cues such as smiling, head nodding, and a forward body trunk and head nodding. I also implemented a systemic approach when assessing and diagnosing the problem. In the next clip, we will begin to discuss the depressive symptoms and the alcohol abuse.